One thing that hasn't gotten a lot of attention from RFK Jr.'s testimony before the Senate, I think it was on Thursday, is he dropped a little hint that access to abortion drug Mifepristone could be cut back. He's going to remove it from the market. He's going to remove access to Mifepristone. I'll bet you $100. Reading from an article in The Guardian, U.S. Health Secretary RFK Jr. has suggested that Biden-era regulations expanding access to abortion pills could be rolled back because the Biden administration had, quote, twisted the data behind the pills. Kennedy made the remark more than an hour into a tense interrogation by members of the U.S. Senate Judiciary Committee over his chaotic tenure at the health department, which has been marked by thousands of layoffs and the promotion of leaders with little background in public health and medicine. Okay, that's a very watered down way of putting it. RFK Jr. has no background in public health, science, or medication, and he's firing qualified people, and he's installing anti-vax whack jobs into things like the Vaccine Advisory Council. Kennedy did not back up his accusation that the Biden administration had twisted the data on Mifepristone and abortion pills, which runs counter to more than 3 decades of research. Mifepristone is safer than Tylenol. More than 100 studies conducted across dozens of countries have found that Mifepristone and misoprostol, the abortion pills typically used in the United States, are safe and an effective way to end a pregnancy. The comment came when James Langford, a Republican senator from Oklahoma, asked RFK whether the Trump administration intended to reverse the Biden-era changes to access to Mifepristone. In 2016 and 2021, the FDA rewrote its regulations of the drug to allow healthcare providers other than doctors to prescribe Mifepristone and to make it easier for patients to receive Mifepristone through telemedicine appointments rather than having to go in person. Senator Langford said, and I mean, he's like a pro-life lunatic. You had said there would be a review on this just to be able to look at it and make sure we're following all the safety protocols. Do you know a timing on that? I can't give you an exact timing. Kennedy said, we're getting new data all the time, new data that we're reviewing. And we know that during the Biden administration, they actually twisted the data to bury one of the safety signals, a very high safety signal, around 11%. We're going to make sure that doesn't happen anymore. Here's the thing. RFK basically testified on Thursday that the National Institutes of Health, the Center for Disease Control, the entire federal healthcare infrastructure apparatus has been incredibly corrupt for the entirety of its existence. And he, a person with no medical or science background, is the only person who can save it. And he's going to restore credibility to these organizations that have never had any credibility at all, according to him. The gold standard in healthcare, viewed globally for the last 70 or 80 years, if not longer, and RFK is going to tear it down to the fucking studs, man. And he's going to take Mifepristone with it. Nevertheless, anti-abortion groups, I'm back to the article, anti-abortion groups, they're whatever. Infant mortality rate in the United States spiked for the first time in 2022 because of abortion bans. It spiked again in 2025 because of abortion bans. And because red states have been rolling back women's access to reproductive health in all forms, not just abortion. Red states' infant mortality rates and mortality rates of mothers who are giving birth have fucking skyrocketed with their abortion bans because they are taking health care away from women. And this is going to make all of that worse. Mifepristone is used in over 50% of abortions in the United States. And he's going to take that away. RFK is going to take that away.